Hi. So I had my surgery 3 weeks ago, and I had my virtual post-op with the nurse practitioner, and it was very reassuring. She said, you're going to have to be patient and give it more time, and just keep doing what you're doing. Basically, walks, rest, ice, use ibuprofen when needed, and give it time. And I told her, I was like, I have to confess, I thought I ruined my surgery because I did these Mackenzie stretches that helped relieve the sciatic pain before the operation, and they're kind of like doing like mini cobra lifts, arching the back, and standing with my hands on my hips and kind of, pushing my chest out, arching the back. And I was like, oh, realized later in the day that I was like, that could be kind of a bend, and that's not what they want us to do. So she said I wouldn't jump to that conclusion yet, that it takes time and it can be a roller coaster, but the roller coaster should settle down more and more, and I should start seeing more progress and more movement forward. I asked her right out, I'm like, at what point do you decide to do an MRI and go in there? And she said, we wouldn't do that until at least 3 or 4 months because, as she said, it's kind of messy in there. We wouldn't really be able to see anything that would help us. So I get it. Overall, it was very reassuring because I'm finishing up this steroid methyl pack. I don't know if I'm saying it right, but that's helped, and hopefully I can just keep working on I can start PT, and I can just, I don't know, just be patient and not freak out and think that, I'm never going to get better. So I hope that helps. That's it.